actually feel very strongly about this is that we need to have Medicare for all.
It could be Medicare for all.
That's what Medicare for all is all about.
But what exactly is Medicare for all about? Depends who you ask. Medicare, which has been around since 1965, is the government-run health insurance program that primarily provides Americans, 65 and older, with basic health care coverage, covering hospital stays and doctor's visits. So put simply, this program would then expand Medicare to everyone?
It would provide essentially free care to patients when they go see a physician or go to the hospital.
Kenneth Thorpe is not a politician. He's a professor of health policy and management at Emory University.
Free sounds wonderful. Who doesn't want to have free care? But the reality is, in order to finance this, people are going to have to pay more in taxes.
Health care in America must be a right, not a privilege.
Bernie Sanders introduced the Medicare for All bill in 2017. In his bill, health care is covered by taxpayers with no out-of-pocket costs at the time of service, even for vision and dental. Just co-pays for some prescription brand-name drugs. All of that while providing access to everyone, and he says dramatically reducing costs. But it is worth taking a closer look at the numbers. In the United States in 2017, we spent $3.5 trillion on health care, nearly double of what other high-income countries pay per capita. Blame administrative costs, prescription drugs, lots of tests and procedures, and not enough preventative medicine. Change that, and Sanders believes we could cut healthcare spending from $3.5 trillion to $1.4 trillion a year.
Those numbers dramatically underestimate the increased spending associated with providing everybody free care.
Both the conservative-leaning Mercatus Institute and the left-leaning Urban Institute have analyzed Sanders' recent proposals and estimated that a Medicare for All plan would cost $32 trillion in new federal spending and taxes over the next decade, while saving only $22 trillion from the private sector, meaning Sanders' plan still needs to come up with funding for another $1 trillion a year, and that even though many will pay less in premiums, many will also still pay more overall in taxes. It's something billionaires Michael Bloomberg and Howard Schultz, who would be most affected by those tax hikes, have railed against.
What the Democrats are proposing is something that is as false as the wall, and that is free health care for all, in which the country cannot afford.
I think it may have been Milton Friedman that said, if you want to really understand how expensive something is, make it free. Does that apply here?
Oh, absolutely, because what sounds free has got to be paid for.
When you look at all of that, Erica, it's still worth pointing out that there's significant support for a Medicare for All program. People are going to get more details, but look at some of the most recent polling data just from this month. 56% in favor, 42% opposed when you call this Medicare for All. Now, if you remind people that this might mean that you're going to lose your private insurance, the numbers flip, Erica. 58% opposed, 37% in favor. And then if you also say this is probably going to mean a tax increase for everybody, because it's not just income tax, it's payroll tax, it's sales tax. Look at the numbers there. Now then 60% opposed.